Hello everyone. Today we'll be talking about postmenopausal changes in the body. What is menopause? Menopause is complete cessation of menstrual cycle which occurs at a median age of 51 to 52 years. Now the effects are divided into three types: immediate effects, intermediate effects and delayed effects. The immediate effects are those which occur within 1 to 5 years. These are vasomotor symptoms, psychological symptoms, and changes in memory and cognitive functions. The vasomotor symptoms are hot flushes, night sweats, which will lead to repeated awakening, and the woman will have poor quality and quantity of sleep. And she will experience an increase in BMI, which means she will have a weight gain. Psychological symptoms are low mood, anxiety, depression, lack of energy, mood swings, irritability, and changes in memory and cognitive functions. Next is intermediate symptoms. These occurs 3 to 10 years after menopause, and they include sexual dysfunction and urogenital atrophy. Sexual dysfunction is that the woman will experience loss of sexual desire, loss of sexual arousal, problems with orgasm, and dyspareunia. What is dyspareunia? Dyspareunia means that pain during intercourse. Second point is urogenital atrophy. This means that there will be thinning of vulva, vaginal dryness and irritation, urinary frequency, urgency, and nocturia. The woman will wake up multiple times at night to urinate, and she will have recurrent urinary tract infections. The last is delayed symptoms. These occurs approximately 10 years after menopause, and they include myocardial effects and skeletal system effects. The myocardial effects are that there will be an increased risk of myocardial infarction, that is heart attack, and increased risk of stroke. The women will have increased LDL and cholesterol and decrease in HDL. This will lead to accumulation of plaques in the arteries and in the blood vessels, which will eventually lead to increased risk of myocardial infarction and stroke. The effects on skeletal system are that she will be more prone to osteoporosis, and there will be likely chances of fracture. The reason for that is estrogen is a hormone that forms balance between the bone formation and bone resorption. Resorption means bone eating or bone destruction, eating. And so decreased estrogen hormone means that there will be increased bone resorption and progressive increase in fractures at trabecular sites. Now an important point over here is that compact bone makes 80% of the skeleton and is estrogen insensitive. So it doesn't matter that the woman is in her postmenopausal age, there will be no effect on the compact bone. But the trabecular bone, it makes 20% of the skeleton and it is estrogen sensitive. So it is more prone to resorption after menopause, and there is likely chance of fractures and likely chance of osteoporosis. Now, what is the treatment? Treatment is lifestyle modification and dietary changes. She needs to quit smoking, quit alcohol, or at least decrease the consumption of alcohol, regular exercise, good diet, eat healthy food, fruits and vegetables. Then non-hormonal approaches could be acupuncture, herbal remedies, or a pharmacological treatment like alpha blockers, beta blockers, SSRIs, and GABA analogs. The mainstay of treatment is hormone replacement therapy. There are two types of therapies: estrogen only and estrogen plus progesterone. Estrogen only is used in women with hysterectomy because it reduces the risk of hyperplasia and cancer. It will reduce the risk of endometrial hyperplasia and cancer. And the second type is estrogen plus progesterone. It is used in postmenopausal women with intact uterus. Progesterone is a hormone which protects your endometrium from continuous estrogen stimulation and hyperplasia, and eventually it will protect the endometrium from endometrial cancer, that is uterus cancer, cancer of uterus. What is a hormone replacement therapy? Let's go into further detail. It is a treatment that is used to restore diminished hormone levels in women in order to relieve symptoms of an imbalance. The types of HRT is implants, patches, pills and tablets, creams, sprays and gels, vaginal rings and suppositories. How to take it? There are two preparations, cyclical combined or continuous combined. Who should avoid it? Any woman with history of breast, ovarian and endometrial cancer should avoid it. If a woman is experiencing unexplained vaginal bleeding should avoid it, and women with blood clots should avoid these medications. The alternative to HRT is lifestyle changes and alternative medicine, which has already been discussed. So this is all about postmenopausal changes or effects on the body. Thank you.